When patients get really, really anxious about a procedure that we're about to do or something that's about to happen, I always say to them, do I look nervous? You can get nervous when I look nervous.
Days can definitely feel like you're on fire and you're putting yourself out with a 99-cent squirt gun.
You care for that patient. You use your knowledge and your skills to take care of that patient. That's across the board. Either you have empathy or you don't have empathy. And that's what makes a nurse. And no matter where you work, ER, ICU, a floor nurse, outpatient, you have to have those feelings and empathy inside of you in order to deliver that care.
A nurse is not just a nurse. A nurse is part repair person, is part communicator, take the media throughout whatever that communication needs throughout the hospital, part architect, part medical clinician on being able to put things together, part environmental services, creates. Nursing almost in so many ways embodies all these different roles each and every day.
Because it doesn't have anybody really taking over for her.
Part of working in the emergency department, each nurse has their specific assignment, but I don't feel that anybody's ever really alone. You definitely have to be willing to kind of reroute your course of the day on a flip of a coin. That's kind of how it goes, every day. That's kind of one of the more challenging parts of it, for sure. Kind of decompressing, taking a deep breath, trying to get rid of, the red face and walk out into a completely different situation. Honestly, de-stressing and kind of airing it out with coworkers is huge. They know what you're going through. They know the toll it can take on you. And having them as support is huge. But a quick walk to the bathroom, sip of water, sip of coffee, and then just kind of being able to put that, part of it in the back of your mind and go say hi to somebody without that stress or that on your mind, being your first impression for your new patient, kind of just takes time.
Come here, my love. Yeah. We're gonna swaddle, okay? I think that people, when they think of a maternity nurse or an OB nurse, they think that we just hold babies and feed them all day, and it is not that. I'm lucky if I get to hold a baby for 10 minutes out of my 8 hours. Of course, we all go into maternity nursing hoping to bring new life into the world and be a part of the happiest day of someone's life. But there are days where you're almost done, kind of there for one of the worst days of their lives. It never gets any easier. I've been doing this for almost 11 years, and it never gets easier. You remember every single baby that you lose. I still remember to this day every single baby that I've lost, and it is a miracle every single time you see a baby born. All better? That's better, huh? Sometimes I honestly, if the dad is crying, I will cry with him. And the same goes for if, we lose a baby, I will cry with my patients. I will stay in that room and cry for hours with them. You just being supportive to somebody and to be there for them in their best or worst time, that's the reward. She looks comfy now, so that makes me happy. Yeah.
Yes, we just gotta get you home.
Yeah.
We're seeing a lot more patients, and we're seeing patients that are more sick now. So that's been a challenge, trying to triage those more sick patients. But it's everything's moving more towards outpatient, so we're seeing our volumes increase. What hasn't changed is the core base of caring for someone and how you care for them, to help someone, to make them feel better, to provide resources for them. I don't think that's changing. Just caring, the core of caring has not changed.
At 10 o'clock at night, after their family and visitors are gone, or 3 or 4 o'clock in the morning, the person that's going to be able to sit there, sit down by their side, hold their hand. If they can't answer the questions, they can certainly give the patient confidence that we will get an answer to them. It's going to be the nurse. There's a lot of things coming in for the patients, and there's a lot of patients going out, and somebody's got to keep everything straight, on target, and on time. And the nurse at the bedside will do the best job of that.